Bismillah Rahman Rahim. Welcome back, friends. Welcome to another video lecture from Chemi Biology. And this video lecture we are going to talk about the protease inhibitor. So now let me write. Protease inhibitor. Now what is protease inhibitor? Protease inhibitor means the drugs which are used to inhibit the activity of the protease. Now which kind of the drugs which are used in the protease inhibitor? Usually these drugs are Amprenavir. Amprenavir. So and the second drug Lopinavir. Lopinavir. Third we have Ritonavir. Ritonavir. So these are the drugs which are used to inhibit the activities of the protease. Okay. Now first drug is Amprenavir. Second we have Lopinavir. And third we have Ritonavir. These are the drugs which are used to stop the activity of the protease enzyme. Now what actually these protease enzyme do? These protease enzyme in HIV viruses, these protease enzyme actually what do? They will cut the long polypeptide chain, or we can say they will cut the long structure, they will cut the long proteins. These long protein actually once these long protein are cutted, then these small section proteins will be converted into a structural protein, and once these proteins are converted into a structural protein, then a mature HIV will be formed. Fine. So how all these processes will be occur? Now let me explain with the help of diagram. First of all, let me explain the antiviral spectrum of these drugs. So if I talk the antiviral spectrum, so it will be activated against HIV virus. Right? Now let's talk the mode of action of these drugs. Mode of action. M means mode, O means off, A means action. Fine. Now the mode of action of these drugs, let's suppose this red one represents the messenger RNA. So it is a viral messenger RNA. Viral messenger RNA. This viral messenger RNA are passes from the ribosomes. Fine. So now it will be passes from the ribosome subunit. So this is the large subunit and this is the small subunit, and this ribosome is actually the host ribosome. Fine. Now it is passes from the ribosomes, and once it is passes from the ribosome, then they will produce what? They will produce a long protein chain, just like that. So these are the protein polypeptide. These long polypeptide will then passes from enzyme, and we usually call that protease enzyme. The structure of this protease enzyme will be just like in this form. So they will passes from the protease enzyme, and what actually this protease enzyme do? This protease enzyme will cleaves. Let's suppose these polypeptide, or we can say these large proteins will passes here. So once they not this protein will passes, this enzyme will passes, and what they do? They will cleaves it. So let's suppose this is the large complex protein. They will passes, and once let's suppose this enzyme is passes from this polypeptide chain, and once they are passes from this polypeptide chain, then they convert this polypeptide chain into a small protein. Now these are then converted into a structural protein. Fine. So these will be converted into a structural protein. Structural protein. So they will be converted into a structural protein, and after that, due to this structural protein, we get a mature virus. mature virus. So we get a mature virus. So this is the function of the protease. Fine. What the protease actually do? This protease enzyme will cleave, or this protease enzyme will cut the long polypeptide chain into a small pieces, just like that, and after that these small pieces will be converted into a structural protein, and then these structural protein will make a mature virus, or we can say capsid will be formed, and which have the means the two messenger RNA and all the necessary enzyme will be arranged inside this capsid, and then the virus will release out from the host having the having the envelope, and this one will release out through membrane budding. Okay, so this is the simple function of this protease enzyme. Now, how this enzyme will be inhibited? We can inhibit this enzyme by using these drugs. Fine. So what happened in this case? So what are the mechanism of action of these drugs? This is, let's suppose, the enzyme. Fine. So here the drug structure will be just like in this form. Drug structure will be look like in this form. So the drug will fit here. So what are the result? The drug will fit in that area. So the drug will. So once the drug will fit here, so this, due to this binding, due to this enzyme substrate complex, we can say it enzyme substrate complex. Now it is enzyme substrate complex because here the drugs is just like the substrate and this is already enzyme. Fine. Now once we get the enzyme substrate complex, then this, whenever they are passes from this polypeptide chain, then they will, let's suppose this is the drugs. Fine. No, sorry, this is, let's suppose this is the enzyme, and this one green area, that the enzyme is actually bind with the substrate, and once it is bind with the substrate, then the enzyme activity will be blocked. See, this is, let's suppose this finger represent that it is a long polypeptide chain, or we can say long complex protein. Now whenever this enzyme are passed, so they are failed to cleave this. Why? Because here the substrate are binded, or we can say here these drugs are binded. These Amprenavir are bind here. So how they will cleave? See, not cleave it. Fine. So this is the mechanism. So this is the mechanism of action of these drugs. Fine. Now here the virus shows resistance against these drugs, and which kind of resistance? So once these means once the polypeptide chain are not converted into structural protein, then how the virus capsid will be formed, and once the virus capsid are not formed, then mature virus will be not obtained, and they will be not released out from the host cell. Fine. Now if we talk the resistance which are activated against these drugs, so this enzyme will be a little bit mutated. So if I draw the mutated enzyme here, so how it will be look like? It will be look like just like in this form. Means this domain area, we can, now this active site, or we can say this active site will be a little bit broad. So this active site a little bit broad. Fine. And the enzyme also will be a little bit large, due to this mutation. We can say this mutated enzyme. Or we can say mutated protease. Fine. So it is mutated. How? Means this area, this domain area will be spread, or this domain area will be this domain area will be broadened from each other, or will be separate. Not separated means they will be far away from each other. Once they are far away from each other, then what happen? Against, if this drugs, let me draw the drugs with a green marker. Let's suppose again when the drugs are passes from here, so what happen in this case? In this case, enzyme substrate complex are not formed. How? Let me draw. Now due to this mutated enzyme, the drugs will come here, but they are not binded. They will be means moving just like they move in this form and in this form, in this form and in this form, because this substrate or these drugs want to fit their self into the active site, but actually they are not fitted. Why? Because of this mutated form. Now due to this mutated form, the drugs are not binded and they will be moving just like in this form, and once they are moving this form, they will be released out. So they will be released out and they will lose their affinity, or we can say they will lose their binding activity to that mutated enzyme, and again this enzyme will passes from these polypeptide chain, and these polypeptide chain again converted into a small section, and then they will be converted into a structural protein. Right? And again the mature virus will be formed and they will be released out from the host cell. Now this is the function of this is the resistance against these drugs. Fine. How? Let's suppose this is the enzyme, mean this is the protease enzyme, and here this is the drugs. So the drugs will bind here. So see, they are not banded, and they try to best, means this movement show that they are trying to best to bend here or to adjust here, but they are not yet adjusted and they are not binded. See, and finally they will be released out, and then this enzyme will again passes from this polypeptide chain and they will cleave it into a section. Fine. So this is the resistance which are activated against these drugs. Now let me talk the side effect of these drugs. If still the patient means take these drugs, then there are some side effect of these drugs. So now let me explain. Hyperlipidemia. Hyperlipidemia. Second is hypoglycemia. Third is fat redistribution. Fourth is abdominal pain. Fine. So these are the side effects, or we can also say nausea also happen in this case. But these are the main side effect of this by whenever you are using these drugs. Fine. So that's all about the protease inhibitor. Now let me explain in Urdu or in Hindi language that what are happening. ये वायरल मैसेंजर आरएनए है, सही है। ये वायरल मैसेंजर आरएनए असल में पास होता है इस राइबोसोम से। तो जब ये वायरल मैसेंजर आरएनए राइबोसोम से पास होता है तो हमारे पास बड़े लॉन्ग पोलियोपेप्टाइड चेन हमारे पास बन जाते हैं, या हम ये कह सकते हैं कि बड़े कॉम्प्लेक्स किस्म के प्रोटीन हमारे पास बन जाते हैं। अब वायरस इन कॉम्प्लेक्स प्रोटीन से लेट मी राइट कॉम्प्लेक्स प्रोटीन। अब जो वायरस है, वायरस वो इन कॉम्प्लेक्स प्रोटीन से अपने लिए यानी अपना कैप्सिड एरिया और स्ट्रक्चर बना नहीं सकता। तो जब वायरस स्ट्रक्चर ना बना सकता है, ना अपने लिए कैप्सिड एरिया बना सकता है, तो वायरस क्या करता है, वो एक एंजाइम यूज़ करता है जिसको हम कहते हैं प्रोटीएस एंजाइम। वो एंजाइम क्या करता है, ये प्रोटीएस एंजाइम यानी यहाँ से पास होता है और इसको क्लीव्स कर लेते हैं। जब इसको क्लीव करते हैं तो ये स्मॉल सेक्शन में चले जाते हैं, जिसकी वजह से ये फिर स्ट्रक्चरल प्रोटीन बन जाते हैं। जब स्ट्रक्चरल प्रोटीन हमारे पास बन जाते हैं तो फिर वायरस का कैप्सिड बन जाते हैं और फिर उसके अंदर तमाम तरह नेसेसरी एंजाइम और हर मैसेंजर आरएनए मौजूद होता है, ठीक है। तो फिर एक मैच्योर वायरस बन जाता है। लेकिन अब इन ड्रग्स का ये जो एम्प्रेनावियर जो है, लोपिनावियर जो है और रिटोनावियर जो है, ये जो ड्रग्स है इनका मैकेनिज्म ऑफ एक्शन क्या है। ये ड्रग्स का स्ट्रक्चर बिल्कुल कुछ इसी तरह होता है। ये आकर इसके साथ बाइंड हो जाता है और फिर हमारे पास एंजाइम सबस्ट्रेट कॉम्प्लेक्स बन जाता है। मिसाल के तौर पर हम इस ड्रग्स को एज अ सबस्ट्रेट ले लेते हैं तो हमारे पास एंजाइम सबस्ट्रेट कॉम्प्लेक्स बन गया। अब इस कॉम्प्लेक्स की वजह से ये जो ड्रग होगा यहाँ से पास नहीं हो सकता, क्योंकि मिसाल के तौर पर यही ड्रग्स है, लेकिन ये जो साइट एरिया है ये एंजाइम है और ये जो ब्लू एरिया है ये क्या प्रेजेंट करते हैं कि यहाँ पे ड्रग्स अटैच है। तो तो ये जो है यहाँ से पास नहीं होगा। मिसाल के तौर ये फिंगर प्रेजेंट करता है कि यार ये आपके पास क्या है, ये आपके पास पोलियोपेप्टाइड है, तो यहाँ से वो पास नहीं हो सकता और ये क्लीव भी नहीं हो सकता। सही है, तो ये इसका मैकेनिज्म ऑफ एक्शन। जब ये क्लीव नहीं होगा तो स्ट्रक्चर प्रोटीन नहीं बनेंगे, और स्ट्रक्चर प्रोटीन जब नहीं बने तो किस तरह मैच्योर वायरस बन सकता है। अब वायरस ने इस ड्रग्स के खिलाफ कुछ रेजिस्टेंस शो किया है। वो रेजिस्टेंस ये है कि ये जो वायरस का ये जो एंजाइम है प्रोटीएज, ये थोड़ा सा म्यूटेटेड हो जाता है। इसके जो ये डोमेन एरिया है, इसको हम डोमेन कहते हैं, ये एक्टिव साइट होते हैं, थोड़ा सा ब्रॉड हो जाते हैं, थोड़ा सा खुल जाता है, ओपन हो जाता है थोड़ा। और ये इस खुलने की वजह से जो जब ड्रग्स आकर यहाँ पे बाइंड करते हैं तो ड्रग्स, मिसाल के तौर पर मेरी ये जो हाथ है, ये वाले एरिया, ये मेरे मिसाल के तौर पर ये प्रेजेंट करते हैं कि ये एंजाइम है, लेकिन यहाँ पे ये ड्रग जो है आकर बैंड होता है। तो देखो ये अब कोशिश करते हैं कि ये बैंड हो जाए, मगर इस तरह मूवमेंट क्या शो करते हैं, इस तरह मूवमेंट ये शो करता है कि ये ड्रग्स अपनी पूरी कोशिश करते हैं कि ये बैंड हो जाए और फिक्स हो जाए, मगर ये ड्रग्स फिक्स नहीं होता। क्यों? क्योंकि ये वाले डोमेन एरिया जो है वो उसका खुला यानी ब्रॉड हो जाते हैं, जिसकी वजह से ड्रग्स ठीक तरीके से बैंड नहीं हो जाता, और आखिरकार ड्रग्स अपनी बैंडिंग एबिलिटी को लॉस्ट कर लेता है, जिसकी वजह से ये ड्रग्स रिलीज आउट हो जाते हैं। फिर इसी तरह ये एंजाइम फ्री हो जाते हैं, और फिर ये अगेन ये जो पॉलीपेप्टाइड चेन होते हैं उसको क्लीव्स कर लेते हैं, और फिर स्ट्रक्चर प्रोटीन हमारे पास बन जाते हैं। सही है। इसके जो साइड इफेक्ट होते हैं हमारे पास, उसको हम कहते हैं हाइपरलिडीमिया, हाइपोग्लाइसीमिया, फैट रीडिस्ट्रीब्यूशन और एब्डोमिनल पेन। पेट में थोड़ा सा दर्द होता है जब ये यानी ये एंटीवायरल ड्रग्स अगर हम इस्तेमाल करते हैं। हमारे पास हमारे जो फैट्स होते हैं वो भी सही तरीके से डिस्ट्रीब्यूट नहीं होते, और इसी तरह ये हाइपरग्लाइसीमिया वगैरह हो जाते हैं। सही है। तो these all about the protease inhibitor, and I hope this video helpful. If you understand, so best of luck, and so please like the video, share the video, and also subscribe the channel to get more interesting video lecture like that. Thank you so much.